Hello, good morning, good afternoon, everyone, and thank you for joining me today. My name's Aneta Gel, and I'm a Quality Operations and Training Manager at Polar Pharma Limited. I have been in the pharma industry for over 25 years, started in production environmental, and slowly worked my way through different roles and in different departments, and now I'm focusing on quality and training. If you have any comments or questions during our session today, please leave them in the comment section of the webinar, and I will come back to them after to respond. So today we are going to look at the paper records and electronic records from a very practical GMP perspective. And this is not intended to be a technology debate, and it's not about saying that one format is automatically better than the other. The real focus is where the control is commonly lost in both. In GMP, records are evidence of what happened or what didn't happen. They support batch release, investigations, stability decisions, deviations, complaints, validations, and other quality decisions. If the record or the evidence is weak, the decision built on that record is of course going to be also weakened. So as we go through the next 30 minutes, I would like to keep one simple question in mind for all of us. Can we trust the record enough to understand what really happened? And that question applies whether the evidence is handwritten, whether it is printed, scanned, stored in a laboratory system, whether it's captured in a spreadsheet or retained in a validated electronic platform. So let us begin with the shared responsibility across both formats. Whether a record is handwritten on paper or generated electronically, the GMP expectation is fundamentally the same. The record must provide reliable evidence of what happened. We need to know who performed the activity, when it was performed, what was recorded, whether anything was changed and why the final decision was justified. One common mistake we see even today is that the electronic records are treated as though they need a completely different integrity standard from the paper records. And of course, the fact is they don't. The controls are different, but the principles stay the same. Paper can fail through retrospective entries, poor corrections or missing pages, uncontrolled worksheets, or even pre-signed forms. Electronic records, on the other hand, can fail through shared passwords, inappropriate access rights, a weak audit trail review, uncontrolled changes, or generally poor system validation. And the highest risk we have when we combine those systems and we have a hybrid system, where the data are generated electronically, they are printed for review, signed on paper, and then stored across more than one location. And in situations like that, the question becomes very important of which record is actually the GMP record, and can we reconstruct the full story? So the discussion is not really about paper versus electronic, but it's more about controlled versus uncontrolled evidence. So what good record control should achieve? A good record control system should make integrity visible to us. So we know the Alcoa principles are a useful way to think about that control of the integrity. So the record should be A, attributable, so we can identify the person who performed the activity. It should be L, legible, so the information remains readable and understandable throughout its retention period. It should be contemporaneous, C, meaning it's recorded when the work is performed, not reconstructed afterwards. It should preserve the O, original information, or uncontrolled true copy of that original information. And it must be A, accurately represented and of what happened. Of course, we know that now we have the expanded Alcoa plus principles, and they add the completeness, the consistency, endurance, and availability to our core principles of the original Alcoa. Those additions do matter because data integrity is not a single moment at the end of the process. It begins when the data is first created and continues through the review and approval, reporting, archiving, retrieval, and eventually the disposal. A completed form is not automatically a compliant record. A signed printout is not automatically a complete electronic record. A compliant record is the reliable history of the overall activity. And this is why the inspectors, they don't only ask the question whether the form is filled in, do they? They ask whether the record allows, as a result, trust the decision that was made based on that. And with that information, I would like to now focus on where the paper records go wrong. Paper records are often more or feel more familiar because that's what we are used to. And that familiarity can make organization less critical of the potential weaknesses they may have. One of the most common problems is retrospective recording. An operator may complete several activities and then return to the form to fill the batch record later. And even if the information entered is factually correct, the contemporaneous evidence has been lost. Blank spaces create another risk. A blank field will leave us with uncertainty. Was the step not performed? Was the entry forgotten? Should it have been performed? Or was information intentionally omitted? We don't know, and the assumptions start to rush in. Good documentation practice will expect unused fields to be controlled so that the record cannot be completed later without explanation. You can have a simple line across, you can have NA, or whatever your company has decided, but that approach, must be consistent. Then we have corrections. Corrections also matter. When we correct a GMP record, the original entry, as we know, should remain visible. We should be able to see what was initially recorded, what was corrected, who made the correction, and when the correction was made, and if it's not clear, why the correction was made. And because that is what will aid the reconstruction of the events and will stand as a solid evidence in decision making. Unofficial records are another major weakness of paper record systems. People may use notebooks, scraps of paper, or even sticky notes, or even temporary worksheets that they saved somewhere, because it makes the job easier for them. But if the information and the GMP information is first captured there and later copied onto an official form, you start to ask questions about the unofficial note. Has that become the original record? Of course, pre-signing and pre-dating is a particularly serious point where paper records can go wrong, because, as we know, the signature is supposed to confirm that an activity has already occurred, rather than pre-signing, getting it ready for the future. Serious point, it still does occur at site. And finally, every manual transcription that we make does create another opportunity for error or manipulation. Of course, when we have the human element there, the error is the chances of error are there, and they need to be managed. So, and these are not minor documentation issues. They will affect whether the paper record can be trusted. Okay, so paper can give a false sense of control because we have it in our hands and it's physically visible. We can file it, we can sign it and stamp it, and it feels more real. But there is an important distinction to be made, and that is that visibility is not the same as integrity. If I show you a handwritten entry that was dated yesterday and signed by an operator, can you prove that it was actually written yesterday? Usually not from just that paper alone, because paper then relies heavily on the procedural discipline, on the supervision and individual behavior. That, of course, doesn't make paper unacceptable, but it means we must understand its limitations, of course. Missing pages can go unnoticed if the form is uncontrolled, issued and reconciled properly. Uncontrolled photocopies can quickly become your working records without any approval. Someone may photocopy a form because they need an extra copy and complete it during GMP activity, and suddenly you have an uncontrolled copy that contains original GMP information. Backdating can be also difficult to detect because paper doesn't naturally generate your metadata or an audit trail. And this is why strong paper governance is essential if you have a paper-based system. Control templates, page numbering, reconciliation of issued forms, clear correction rules, timely review, and a good archival controls are not the administrative niceties or the bureaucratic burden for some. They are the data integrity controls. So paper may be simple, but it is not automatically safe. Now that we've looked at the paper records, let me have a look at electronic ones. So where do electronic records go wrong? Electronic systems bring major advantages, but technology is not a safeguard by default, as we know. We've got the shared usernames, one of the clearest examples of that. If several people use one account, the system may show that an action occurred, but we can no longer reliably determine who performed it. So our attribution has been damaged. And believe it or not, it still happens today that we see the shared usernames and accesses. Excuse me. Then we have administrator privileges. they are another important area when we talk about electronic records. So people performing your routine GMP activities should not be able to alter configurations automatically, or delete information, or change critical data. I have witnessed teams where the admin rights have been given to inappropriate personnel who did not understand the level of changes that they were requested to make, and what was the impact. And then the result was quite a shocking revelation of lots of bypass controls and changes without authorizations. So a very important point to keep in mind. Audit trails are also frequently misunderstood. An organization may say with confidence, yes, our system has an audit trail, but the existence of an audit trail does not provide assurance unless the relevant audit trail is enabled, protected, it's reviewed, and it's understood and acted upon. And here we have the most practical question when it comes to audit trail. Which audit trail really matters? Who should review it? How often should they review it? Against what criteria? What are we looking for? And importantly, what happens when we discover an unusual activity? So, electronic systems also contain information that may not appear on a printout, the so-called metadata. It's the processing history, the previous versions, the deleted records, and user activity. And the system itself must be validated and governed. Purchasing a respected software package does not transfer your GMP responsibility to the supplier. You are still responsible for your information, for your data in that software package. The regulated company remains accountable for the integrity of its records. So, one of the most common misunderstandings with electronic records is the belief that printing and signing a report makes the record complete. A printout may look complete, but it may represent only a small part of the actual data. Let's think about chromatography. A chromatogram may be printed, reviewed, and signed, and then the paper package may look all nice and tidy. But what happened before the printout was produced? Was the result reintegrated? Were the injections repeated? Were any runs aborted? And has there been a change to a processing method? Any results deleted? And then we want to know who performed the actions. And our printed chromatogram may not answer all of those questions. It may answer some, but not all of them. The electronic system may contain the metadata and the audit trail information that is needed to understand the full history behind our chromatogram report. And this is why the difference between static and dynamic data is so important when we talk about electronic records. So your printout is usually the static form. It's a snapshot. And the electronic record may be dynamic and may be necessary to reconstruct how the final result was generated. And that electronic record sits in the system. Important fact to remember is that printing electronic data does not automatically turn the printout into a complete GMP record. QA and operational reviewers need to understand what constitutes the full data set required for the meaningful review. Otherwise, the review may confirm only that the printout exists and not that the underlying data is reliable. So this is kind of electronic records in a nutshell. And now let's have a look at when we use the systems where the two are combined, which is called the hybrid systems, and what are the pitfalls there. So hybrid systems, the worst of the both worlds. Most pharmaceutical companies operate hybrid systems. Currently, we have very few sites that are entirely paper-based or entirely electronic. And the challenge with hybrids is that every time your information moves between formats, another risk is introduced here. Imagine a result is generated electronically and it's copied onto a paper worksheet. Then it's entered into a spreadsheet, summarized in a report, and then reviewed in a quality management system. So what we have now is several representations of the same information. Which one is the official record? What happens if those representations do not agree, do not align? Who checks the transcription? And at which point can the data be changed, or which points? There might not be just one, but number of points where the data can be changed. And where is the complete record retained? And again, I am not saying that the hybrid systems are automatically non-compliant here, but what I am saying is that they do need explicit governance. A useful exercise to perform when you are running a hybrid system is to map the data flow of critical processes. You start with, you run a map process or flow for one process, and then you do all the others. So you start with where the data are first generated, and then you follow where they move, where they are copied, where they can be changed, where they are reviewed, and then where they are finally retained. And this exercise, this mapping, often reveals to you unnecessarily manual steps that nobody has really challenged for years, because they've kind of been hidden and forgotten. And when you remove unnecessary transcriptions and you clarify ownership, that will significantly reduce your data integrity risks. So hybrid workflows are manageable, but only when the organization knows exactly where the authoritative records live and at which stage that authority is applied. So now let's move to inspectors and what they face when it comes to those records. When inspectors review records, they are usually assessing whether they can trust the organization's evidence. And one of the most revealing requests is often very simple: show me the original data. And that request can expose uncertainty very quickly. If the team doesn't know whether the paper record or the electronic record is official, there is already a governance issue that is surfacing. Inspectors will also want to understand your authorship and the changes. Who created the record? Who modified it? Who reviewed it? The questions that we kind of all know and been through. Who approved it? And can the information be deleted, overwritten, or changed without any detection? If we see that the data has been changed, is there an audit trail or documented correction that explained what happened? Backup and retrieval. Another very important point that the inspectors tend to look at. It's not enough to just say that the records are backed up or archived. If the records are retained for years, but they cannot be retrieved, or once they are retrieved, they cannot be opened, and when they are opened, they cannot be read, then the retention system is not effective because you haven't got data if you can't open it, or it's not in a readable format. So again, you can apply a practical self-check. That is, you select an older batch or a completed study and you attempt to reconstruct the complete record from the source data to a final decision. And you even go and you ask to retrieve the documents that have been archived. So the retrieval should be tested regularly, and we should make sure in our testing that the data that is retrieved can be opened and is in a readable format. It's a very important part, and it's in a high focus currently. And if you do the exercise, that often identifies the weaknesses before you get to your inspection and before your inspectors will identify it. It also helps your teams, and they will move from the theoretical compliance, that what is written on the paper, to a real evidence control. So you will know what's written in your SOPs about your governance. You will know that in practice it does work. And now let's have a look how we can start building a better record management. So, of course, the solution is not to buy more technology, because better governance starts with the initial step of defining what is the official record for each critical process. Everyone should understand where the authoritative information resides and which supporting records are required to reconstruct the activity. Then we have the next step, which is simplification. Every unnecessary transcription, a duplicate worksheet, manual handoff creates another control point and another possible failure mode. Where possible, you should reduce the manual transfer of data between systems and remove duplicate records that do not add value. The process mapping, which I mentioned earlier, will help you identify the areas to focus on. Electronic users should have unique accounts, as we know, with access aligned to their role levels, and this should be reviewed regularly. Don't just set it up and then never look at it again. It should be reviewed, the levers should be removed, and anyone that changes department, their access level should be updated so you know it's current. And if it's reviewed by the inspectors, you have nothing to worry about because you know you are in control. Paper systems need equivalent discipline through controlled master forms, issued copies, completed record reconciliation, and of course, the secured retentions. When it comes to training, that also needs to evolve. The traditional good documentation practice training often focuses on handwriting, the ink, the dates, and the corrections. And those topics still matter, but the modern reviewers also need to understand the metadata, the audit trails, the electronic signatures, the access control, and the overall life cycle of your electronic data. So update your training, evolve with how your documentation systems are evolving. And finally, organizations should periodically test whether they can reconstruct the critical historical records from the beginning to end, as I've mentioned before. And this is the test. This is one of the most practical ways to confirm whether your governance is working. So the key message here is not that it's not a debate about paper versus electronic system, as I said at the beginning, but it's a debate about controlled, versus uncontrolled records. And that is whatever shape they are in, whether they are paper, electronic, or hybrid. A well-managed paper system can provide reliable GMP evidence. A sophisticated electronic system, on the other hand, can produce unreliable evidence if access, review, and governance of that system are weak. Technology, as you know, does not automatically create data integrity and compliance just by itself. Digitization should not simply take a badly designed paper process and reproduce it electronically. If we were to do that, it would just give us the same problems with the added passwords in kind of simple terms. And the objective here is much simpler, because what we need is records that allow us to understand what happened, when it happened, who performed the activity, what changed, who reviewed it, and why the decisions that were made were made. And if the paper record says one thing and the electronic system tells another story, that is not a harmless inconsistency. It is a data integrity concern, and it requires your attention and investigation. Because ultimately, the data integrity is not IT responsibility, it's not documentation responsibility, and it's not a QA responsibility. It is a pharmaceutical quality system responsibility. So it is a responsibility for us all working in a pharmaceutical company. And a strong governance connects the process, the people, the technology, and the review nicely together. So with that, let me bring this a comprehensive overview to a close. Thank you for joining me today. I hope that it has helped you make the risks around paper and the electronic records and hybrid records more practical and easier to kind of recognize and ground yourself in. As the next step, I would really encourage you to choose a GMP record or process at your own site and test whether you can reconstruct the full story from start to finish. Identify where the data was first generated, where it was copied or transferred, who's got the ability to change, and who reviews, and then where does the complete evidence lives? Where is it retained? And the exercise is simple, and it can reveal a lot of information for you. If you would be interested in more training on data integrity, GMP compliance, and quality operations, please connect with Academy of Pharmaceutical Excellence using the contact details provided, or you can contact me directly at anetagel@pqs.ltd to see what training or support we can provide. Thank you again for your time today, and I wish you a lovely rest of the day. Thank you. Bye.